Well, I had a hysterectomy about 5 or 6 years ago, which I gained about 50 pounds, and I've tried every single possible diet that is out there, and I was not able to lose a pound anyway, dieting or exercise or anything. Then I met Dr. Carlson, and since then I've had several lipo procedures. The first one I went from being in size 16, barely, I mean I could barely fit into, and after the first procedure of the liposuction I went down to a size 10, so I dropped 4 sizes just in the first procedure. So now I'm coming back to get some touches up under my arms and my inner thighs and my hips. So I'm very, very happy with everything that's happened.
And you don't have a whole lot of fat here, so it's not as dramatic as like on the hips and stuff.
Sure. Just removing some of the fat in the inner thigh. Sometimes this is actually a very uncomfortable area, but the numbing medicine makes it fairly straightforward. After the procedure, sometimes people will have sometimes after the procedure, patients will have some discomfort because the skin is rubbing against each other as they walk. So this is probably, of all places, the inner thigh is the most uncomfortable compared to the stomach, the arm, the thighs, and so this is usually the most uncomfortable section. And just kind of going in along. The femoral vessels are deep to here, and so I'm staying obviously very superficial to them. I'm very comfortable with that since I used to take all the veins out for heart surgery, and I also used to do a lot of femoral popliteal reconstruction surgeries. So I know that this is in a safe area. I'm in an area above where those arteries, veins, and nerves are. You can kind of see the fat coming out through here. It's going to be important after the procedure to wear a garment in this area. By doing this, it actually breaks up a lot of the fat, removes some, but breaks a lot up too, so that the thigh can be remodeled. And so wearing a garment is important at this early stage after the procedure.